So the first question is just in general, really basically, what are the arguments for the vaccine? What's the purpose of the vaccine? How does it work? How do we know it works? And how effective is it? Which we can take those one at a time. But
So the reason for taking the vaccine, for the most part, the best argument for it is to protect the people, not necessarily the people that or the most or the majority of people that are getting it don't really need that much protection from the virus since it's such a low mortality rate in young and otherwise healthy people. But the issue with this virus is that there are drastic differences in the way that it affects people depending on risk factors. The biggest risk factor is age. People that are older than 60 to 65 years old have the highest risk. And it's probably tenfold higher mortality risk for people that are in that age group compared to people that are younger than 60 to 65 years old. Other things like diabetes, high blood pressure, obesity are the other big risk factors for higher mortality, whether you're young or old. So it's about trying to get to a herd immunity so that
right,
we can protect the most vulnerable. There are some people that can't take the vaccine for medical reasons, actually have had bad reactions to vaccines before, or
right.
have other things that they don't feel like it's something that they would take the risk to do.
Mm-hmm.
Maybe people that are on chemotherapy have a compromised immune system. It may not be as effective in those type of people, and so the best argument for everyone or almost everyone taking the vaccine is for that, is to protect the most vulnerable, even though you yourself may not
Right,
need to have that
right.
protection. Somebody like me or you, or
Mm-hmm.
less than 0.1% chance. If so, 99.9% of people our age will, unless you have some other
Survive it.
comorbid
Right,
condition,
right. Sure,
um,
sure,
99.9% survival. I
sure.
have seen some young people get really sick from it and
Yeah,
have to be
yeah,
put on ventilators, but that's
yeah.
rare.
Right. So here's a, and let me make this a little bit bigger. Here's an illustration of how herd immunity works. And so there's a bunch of different scenarios here. So this first one here that you see is if you have 5% vaccinated or 5% who've gotten the virus, and how the virus spreads. This is if you have 30% vaccinated, and here's if you have 75% vaccinated and what happens. So you run the simulation here, you can see now the red dots are the people that end up getting the infection, and you can see the more you vaccinate, the less likely it is that the people, even the people that don't get vaccinated, it's less likely that they'll actually
Right.
get the virus. And there's a bunch of different
That's
scenarios on
great.
this site that will show you how it works given different. So if you have a more infectious variant, this is another simulation, and you can see the numbers there, just how many people actually get infected, given the different levels of vaccination. And so you brought up herd immunity there, and so herd immunity. So tell us what herd immunity. Go a little bit more in depth about what herd
Yeah.
immunity is and where are we trying to get in this virus. I know it's not completely known,
Yeah,
but
I'm not sure what the exact number is, but it's probably somewhere between 60 to 90%.
hmm
But
yeah,
we don't know exactly what that number is, because the problem with this virus in particular is that there are so many people that have it and are minimally symptomatic or asymptomatic, and some people have, even without getting it or without getting a vaccine, have some level of immunity against it. They did a study where they looked at blood samples from people that donated blood before the COVID pandemic
yeah,
hit, and about 40% of those blood samples had some immune system or antibody activity against the COVID-19 virus.
yeah,
It's probably because they had had a variant of coronavirus that was similar enough to where there
hmm
was some immune system response to it. And so we don't really know exactly how much
hmm
vaccination is going to have to happen, because we continue to have people getting it that
hmm
aren't having, much in the way of symptoms. And so we may not ever test them. They may not ever even know they had it.
hmm hmm
I did see a study recently where they had looked at healthcare workers, and they found about 30% of healthcare workers had antibodies or,
hmm
immune system activity against it, um, but or evidence that they had had it recently, I guess
hmm
is the best way to say that, because even if you don't have antibodies to it, you may have had. I mean, your antibodies wane after several months, and so you may not be able to test for antibodies, but about
But you still
30%.
have residual immunity.
Right.
Yeah.
You have memory B cells that are able to
Mhm.
basically jumpstart your immune system to respond to it
Right.
and
And so you
make
may
antibodies.
so you could still have an infection, but it would be asymptomatic or not even at all. But
Very, very
yeah.
unlikely to be a severe case.
Right. Yeah.
Yeah.
Okay.
Almost no reports of that kind of thing happening.
Okay.
Yeah.
All right.
I think I got off track there a little bit.
That's okay. No, that's okay. That's all
So
right.
herd immunity. So
Yeah,
the
herd
idea of
immunity.
herd
Yeah.
immunity is, so even if you don't have everyone in a population that's vaccinated, just like that's a great illustration that you showed, the animation there, with the dots that have been vaccinated or have had the virus. Even if everybody isn't vaccinated or everybody hasn't had the virus, there's a lot of protection, because people that you come in contact with, if you have 80% of the population that's been vaccinated, there's a lot lower chance of them getting it and spreading it to somebody who hasn't been vaccinated.
Right.
So it's just the idea of getting to the point to where that R naught is less than 1. So you want to get it to where somebody is not spreading it to another person. On average, right now it's around 3. Or before we did any vaccinations.
Right. So the
So
R
it's about
naught,
two
the
times.
R naught is the spread rate. That's the
Right.
number of people that an infected person on average spreads it to.
And for coronavirus, it's around 3.
Yeah.
And for influenza, it was around 1.5 or 2. So it's about 2 times more likely to be spread to other people.
Yeah.
Influenza.
So it's more infectious. It's more contagious. It's easier to spread it to other people.
Right.
It may not even be because it itself is more contagious. It's just that it carries itself in such a way that people have it and they don't know.
So,
and
such a variation is such a weird thing, because it may be like this for other things, but we just haven't been paying that much attention to it, because it hasn't caused. It's so crazy how different it affects different people.
Right. Yeah.
Even people of the same age, same risk factors. You can have one person get really sick from it and one person not. And there's, there's predictive risk factors, but there's no definite way to tell whether you're going to have a severe case or not.
Right. Yeah. And there are other variables like viral load that you get, and so all kinds of things.
Yeah, there's data suggests if you're wearing a mask and you get exposed to it, you would have less viral particles get into your respiratory tract than you would if you weren't wearing a mask. And there's evidence to suggest that would cause less severe disease than if you are.
Right. So in other words, it's not just the mask not only prevents you from getting the virus, it does help that, but probably even more than that, if you get it, you get a lesser dose of the virus, and will probably have a less severe case. If you get exposed with a mask on. So
lowers the amount that you have, lowers the amount that your body has to react to. Gives your immune system a little bit longer of a response time because the virus is going to double. It'll have a doubling time to where it's replicating. And if it starts off at a lower level, then it'll give your immune system a little bit extra time to form antibodies and react against it.
Okay. So that's herd immunity. As far as back to the vaccine itself, side effects, what are the known side effects of the vaccine itself?
So this just shows you that's the first dose. That's 40,000 people that receive Pfizer or Moderna BioNTech vaccine. Almost nobody has systemic side effects after the first dose. And then the chart on the right is after the second dose. And it spikes at about 10% of people that have significant side effects at day 1. And then it trails off after that. Like I said, most common thing is fatigue, headaches. And then less common things are fever, joint pains, muscle pains, nausea, diarrhea.
Yeah.
But after about 3 or 4 days, almost nobody has any residual side effects.
Okay. And what about so we had a question about like allergic reactions to the vaccine. What are the numbers on that?
So the last information that I just looked that up because we got that as a question. There was 145 million people that have received the vaccine.
Yeah.
And the numbers for severe reactions were about 1 in 200,000. That's at the high end.
Yeah.
It was somewhere around 2 in a million up to 5 in a million. So 5 in a million would be 1 in 200,000. Could be as low as 2 in a million.
Right. Yeah. Okay.
So extremely rare, and nobody no one has died that we know of. I mean, it's possible that somebody could have died from
people
it.
have taken the vaccine and died, but there have been none that have
Nothing where they determined that the
Yeah.
vaccine is what caused it. There was,
Right.
I mean, there's only been a few thousand of all the people that have gotten the vaccine. There's only been a few thousand that have died since they received it. With a population that big, you would expect to see a few thousand deaths anyway. There was no increase in the expected death rate,
mortality of that group,
mortality of people that have received it. So severe reactions extremely rare, way less extreme or severe reactions than there are deaths and severe infections from people that get the
I mean, if you've got, so in other words, if you've got 100 million people, if you're looking at a group of 100 million people, I mean, they're going to be dying one every, I don't know, 20 or 30 minutes.
Something like that.
In 20 or 30 minutes, every 20 or 30 minutes, somebody in that group is going to die.
Right.
Out of 100 million people.
Right. It's probably something like that.
So I mean, whatever the math works out to be.
Right.
But of that group of 145 million, the same number of people that you would have expected to die by just normally without having had a vaccine, the same number of people died.
Yeah.
So if you had seen, if you observed this group of 145 million people that got the vaccine, and instead of one dying every 20 minutes, it was one every 5 minutes, you might think, ooh, that's not good.
Exactly.
What's different? And if it's the vaccine, then you would be able to recognize it maybe.
Yeah.
And
they had the same data set that I was talking about, they had reviewed. So there was a few thousand that had been reported as, dying close to the time that they got the vaccine.
Yeah.
And reviewing those cases, they found no indication that the vaccine was the cause of death in any of those cases that were reported. And that's a few thousand out of 145 million.
And that includes people that had anaphylactic reactions.
Correct.
Which is that one in 500,000 or so. None of those people died.
Right.
That had an anaphylactic reaction.
None, at least none that were reported.
Right.
I mean,
right.
No data set's perfect. So
yeah.
I mean, but anaphylaxis is very treatable. I mean, EMS crews have the medicines to treat that.
Sure.
So as long as you get treatment in a short time frame, then
Okay.
Unlikely that you die from anaphylactic reaction from anything, peanuts or vaccines or what have you.
Yeah. FDA approval, we had a question or two about how the FDA approved it. How is it different than other vaccines in the past? So FDA approval.
This is something, so the mRNA vaccine, the idea of this and the actual mechanism for delivering mRNA to the cells is something that's been studied for about 30 years. There's never been a vaccine that has been mass produced and tested on people like this before. This is the first of its kind to go to the masses like this.
Mm-hmm.
But it's something that's been studied for a very long time. They've done animal studies, a lot of rat studies. It's been shown to be safe in all of those. The biggest problem has been the delivery system for the mRNA. And so what they've done with this and what they had figured out they could do is they would package the mRNA inside of a little lipid bilayer called a micelle.
Mm-hmm.
And that's what you actually get injected. You get messenger RNA in a little lipid bubble, basically. Gets injected into your subcutaneous tissue, gets picked up into the bloodstream, distributed throughout your body. And then those little bubbles stick to different cells throughout your body. And it opens up and releases that messenger RNA into the cell, and then not in the nucleus of the cell, but in the cytoplasm, there's these little things called ribosomes that transcribe. Messenger RNA is just like, it's like a little data packet, basically, that encodes what proteins that your body or that a virus or any other kind of cell wants that cell to make. And if mRNA is floating around in the cytoplasm, it'll get transcribed. And then once it's transcribed, then it just degenerates and falls apart.
Away. So it doesn't replicate. It doesn't go into your body and create an infection that your body then reacts to. It's
correct. The only thing that's in these vaccines is a piece of messenger RNA that has a code in it that signifies the code for a surface protein that is just like what's in COVID-19.
The spike. Virus. I've seen the picture of the virus with the little red spike things coming off of it. That little spike piece.
That's the only information that's in this messenger RNA. So the cell produces however many pieces of messenger RNA get into that cell, it'll produce that many pieces, and then
Right.
those get displayed onto the cell wall
Mm-hmm.
or cell membrane, and then that your immune system recognizes that as a foreign
Mm-hmm.
protein,
Mm-hmm.
and then
Yeah.
your immune system starts activating against that, makes antibodies against it.
Right. Right.
And so that's the Pfizer and Moderna vaccine.
And so then when the real virus comes in, your body
Right.
already knows, it already recognizes that spiky protein thing, and it
Right.
says, that's bad.
Right.
I'm going to attack it before it has a chance to cause an infection.
Exactly.
So, yeah. All right.
Just gives you a jump start, gives you your immune system a cheat sheet
Yeah.
to use against the virus.
So we know the vaccine, it was created pretty quickly,
Mhm.
and some people are concerned about the speed.
Sure.
It got emergency use authorization right from the FDA.
Yeah.
So go maybe talk a little bit about the process the vaccine went through.
Yeah. So it had to go through the same. It was an expedited process, meaning they did it more quickly,
Yeah.
much more quickly than they usually
Yeah,
do
sure,
with vaccines.
Yep.
And one part of that is because of the type of vaccine it is, it being the first of its kind. Messenger RNA vaccines lend themselves to being able to be produced very rapidly compared to other types of vaccines, because it uses it's a cheat code.
Mm-hmm.
You get the code for the spike protein, and your cell does the rest of the work.
Mm-hmm.
All you got to do is get it into somebody's body, and you can change that code to be whatever you want.
Mm-hmm.
And it's way easier to mass produce mRNA than it is to produce medicines or spike proteins or other things that you might use for.
So we'll be able to use this technology hopefully in the future.
Yes.
I mean,
there's so many things they can use it for. I mean, medicines that your body can basically produce a medicine because of the code that's on the messenger RNA.
Mm-hmm.
So it's something that's going to be used. I mean, the people that came up with this are going to be they're going to be super wealthy.
Yeah,
and they should be.
Sure,
I mean,
it's
a miracle.
Yeah,
it's a miracle treatment.
Yeah.
So it was expedited, but it still went through phase 1, phase 2, phase 3 clinical trials. They just expedited that, and that basically is they take a small number of people and make sure they don't have any bad side effects, make sure that it's effective. Then they do a larger group, and then a larger group, and they look for side effects, bad reactions. And so it went through all the phases that a medicine or a vaccine would normally go through. It was just in an expedited fashion.
And when did it start? I mean, they got it out. I mean, they didn't release it to the public until November, December, but the first trials were July, something like it.
June, July.
July.
I don't know
so
exactly,
I mean,
but it was several months before.
So we've got people that are walking around that were vaccinated 7 or 8 months ago now.
Yep.
And there have been no known long-term side effects from that as far as we know.
There's nothing that we know of. Of course, it's impossible to say any new medicine or any new vaccine or any new type of drug that gets produced. There's no way to know about long-term side effects until you get to the long term. And we're not there yet. It's going to be a long time before we're there. But there's nothing to indicate the way that it works, what's included, the ingredients that go into it.
Right.
There's nothing to indicate that it should have any long-term effects, because like I said, once it produces that protein, that spike protein, that messenger RNA is gone. There's nothing else. There's no other medicine. There's no other drug in it. It's a lipid bilayer that contains a little lipid fat bubble that contains messenger RNA.
So it just leverages your immune system to be used in the same way it's always used whenever it encounters a new
foreign protein or
anything. Yeah. Okay, and that's the only function of what's going into your body is
and
to
it doesn't get into
that.
your DNA and modify your DNA or anything like that. There's no mechanism that it could do that. I mean, a piece of messenger RNA can't be incorporated into your DNA. There's no it just doesn't work.
Right. Okay. Okay, so a lot of the concerns, which is very reasonable to have, is the effects on fertility, birth defects on in utero. What any data on that?
I mean, they excluded pregnant people from the initial trials. They recently started doing a study in 30,000 pregnant and breastfeeding women. So far, there's no indication that there's any side effect. That's not done yet. I mean,
Sure. Yeah. It's still
it's
in the
just
trial.
like any other
We're not in the
vaccine or
long run.
drug.
We're not in the long term.
We don't give it to pregnant people to start with. We give it to people that
Yeah.
are not pregnant.
Right. Right. Yeah.
Because you don't want to do anything
Right.
without knowing for sure. But
Right.
there's
Right.
nothing in the mechanism of the way that it works. There's nothing to indicate that it would cause a problem, and that's something that I mean, every person's going to have to make the decision for themselves.
Right.
The
Sure.
chance that it would cause any long-term problems or birth defects, I mean, there's not any data on it in humans, or there's very little data, but there's no reason to think that it would cause a
Right.
problem.
Sure. Yeah.
Nothing to indicate that it would. Just like there's
Yeah.
nothing to indicate that it would make you grow a third arm
Mm-hmm.
or a horn on your head.
Right. Sure.
We don't know for sure. People might start growing horns.
Yeah.
But
Yeah.
there's nothing to indicate that it would do that.
Right.
And so
Close to the mic.
Oh, sorry.
Okay. So, if you've had COVID, so like me, I've had COVID. Are there any significant reinfections from people that were infected early or late? I mean, in other words, how effective is having the virus at giving you protection from reinfection and severe disease?
So there's been a very large study done. I can't remember where. I think it was. I can't even remember now. I looked at this the other day. It was 530,000 people that they did a population study. And it basically, people that had gotten COVID in the first wave, it was about 80% effective at preventing them from getting reinfected in the second wave. So a few months later, 2 or 3 months later. And so we could presume from that it's probably similar, if you get the vaccine, since it's the same, similar immune response. So there is still a 20% chance of you getting reinfected. Now, the chance of you having a severe infection, if you've gotten it once,
is very
probably
low,
close to zero. I mean, it's already pretty low anyway.
Right.
And so, especially if you're young and healthy now, people that were elderly, people over 65, had a significantly higher chance of getting reinfected. It was only about 60%. Do you remember?
I think that sounds right.
We talked about it the other day. I want to say it was 60%. Or no, it was 50%. It was like 47%, I think.
Yeah.
So it was about 50-50 chance of getting or 50% protective. So out of those 500 and some odd thousand people, they looked at the number of people that got reinfected and having had it or got infected during the second wave, and having had it in the first wave was about 50% effective at preventing you from getting it in the second wave.
But that was only like 2 or 3 months different. I thought it was longer than that. I thought there was
first
longer
and second
difference.
wave. I think it was 3 months, but
okay,
I could be wrong.
Yeah. Okay. But
somewhere in that ballpark.
But there was
4 months.
There was more protection from severe disease than just 80%.
Yeah. That's from getting reinfected.
Reinfection.
Of preventing documented reinfection.
But a higher rate of preventing severe disease.
I'm sure. Yeah.
Yeah. Okay. Yeah. Okay.
It's almost, I mean, like with the vaccines, it's almost 100%. I mean, it's essentially
100% effective at preventing severe disease.
Hospitalization,
right?
Having to be put on a ventilator. So it should be similar to that.
Yeah.
With the actual infection itself.
Okay. Somebody asked about the differences between the Johnson & Johnson vaccine, the Pfizer, and the Moderna. So there's mRNA, the Pfizer, Moderna, or mRNA.
Right.
Johnson & Johnson.
That's the one that I was talking about. The Pfizer and Moderna are the 2-dose vaccines. Messenger RNA that's packaged in a lipid bilayer, lipid fat bubble, gets delivered into, get the shot, delivered into the cell. Messenger RNA goes into the cytoplasm, gets transcribed into the surface spike protein. The Johnson & Johnson AstraZeneca vaccines are basically, it's a similar end result. They end up producing messenger RNA that gets transcribed into a surface spike protein, but it gets delivered in a different way. They used a chimpanzee adenovirus and put the DNA, a piece of DNA in it. Now that one, it gets taken up into the cell, goes into the nucleus of the cell, and then that DNA gets transcribed into messenger RNA. Messenger RNA gets into the cytoplasm, and then that gets transcribed into a surface spike protein. So it's the same end result, but it's just a different way of
pathway of
it.
getting it there. Yeah. Okay.
Now, there's the same thing applies with that. They used a virus, a adenovirus, but they took the DNA out of it.
Mm-hmm.
They put in a little piece of DNA that didn't have the information for the virus to replicate.
Mm-hmm.
It doesn't get incorporated into your DNA. It's just a snippet
Mm-hmm.
that's enough to make a piece of messenger RNA. Then
Right.
that piece of DNA degenerates and falls apart after it gets transcribed.
Okay. All right. Okay. So, and I think the CDC actually issued something on this today. Some people were concerned because they were saying that you take the vaccine, but then you can still spread it to other people. And so the question is, it's my understanding that being vaccinated doesn't prevent the spread of the virus, but instead will provide me a level of immunity that prevents me from dying. So how does me being vaccinated protect someone of higher risk if I'm still able to contract and spread the virus?
So
Is the
it
question.
doesn't provide 100%
Right, right.
prevention of spreading it. There's still a chance. So you get vaccinated, your body has enough time to form an immune response to the virus or to the vaccine, to that spike protein. You build up antibodies to it, and if you wait long enough after the second vaccine, they say 2 weeks afterward is whenever you should be fully immunized. If you
Mm-hmm.
get exposed to somebody who has COVID-19, the vaccine doesn't form a barrier. It doesn't form a bubble around you to prevent the virus particles from getting into your nose or into your mouth
Right,
if somebody
right.
coughs or sneezes. So there's a possibility that you could get it and have
Mm-hmm.
a subclinical or no symptom infection.
Mm-hmm. Mm-hmm.
And it's
It's possible.
possible and it's theoretical that you could then, carry that home and spread it to somebody, or touch your mouth and touch
Mm-hmm.
something, or
Mm-hmm.
cough or sneeze for allergy reasons and spread it somewhere. So
Right.
it's theoretically possible, but the chance that you would spread it to somebody else is drastically reduced if you're immune to it, because your immune system is going to cut it short and stop it from being able to replicate. So you won't have as much virus in your
Mm-hmm.
system.
Yeah.
You may
Yeah.
not have any symptoms. You won't be coughing. You won't be sneezing. So that's
So it's.
the main way that it's
I mean, the
checked.
bottom line. It sounds like to me getting the vaccine is effective at preventing you from spreading it to other people
It
if you
is.
get it.
It's not
It's not
100%.
100%, but it's
So they're
very
not going to
effective.
say
Yeah.
it will keep
Right.
you from spreading it.
So
They're
there's.
taking the most conservative approach in the
Yeah.
CDC guidelines, and
Right.
Dr. Fauci. They're taking the most conservative approach,
Mm-hmm.
and you know,
Right.
maybe even to a fault.
Yeah, I think so.
But
But yeah.
um, they would rather be safe than sorry. I mean,
Yeah.
they're taking that approach. That's
Right.
what they always do,
Yeah. Yeah. Right. Right.
and they give guidelines. It's not mandates. It's
Right.
guidelines.
Right. Yeah.
This is the best
And,
possible way to proceed.
and it's fine. And I'm fine with speaking probabilistically. So
Right.
probabilistically, if you get the vaccine, it's almost sure you're almost sure that you're not going to spread the
Right.
virus to somebody else.
Yeah.
But just say
Almost sure.
so just say
Yeah.
it that way, but they don't say it that way. So
Yeah.
okay, so the question came in. I can barely read this. Is it true the Johnson and Johnson vaccine is 65% less effective with the same side effects as the Moderna Pfizer? Or it's only 65% effective.
So
But
this shows the studies that were done and the results of the studies that have been done so far with the different vaccines. The Pfizer BioNTech was 95%, Moderna was 94%, and that is 94% effective at preventing a clinical infection, preventing somebody
yeah,
from having symptoms where they knew that they had an infection.
yeah,
Okay, so it's not
yes,
100% at preventing infection, but those two have also been shown to be 100% or close to 100% effective at preventing hospitalization and serious disease. Now,
Pfizer,
the
Moderna. Yeah.
AstraZeneca,
Mm-hmm.
Johnson and Johnson have also been shown to be almost 100% effective at preventing severe disease
Mm-hmm.
and hospitalization, death, intubation, or having to be put on a breathing machine,
Right.
which is what you see with the most severe cases of this. So
Mm-hmm.
those two have also, they're almost 100% effective at that. They're 90+%.
Yeah.
But 60 in the 60s, 62% for AstraZeneca, and then depending on which there was
Three different
three different
populations. Yeah.
populations that they studied, and there's some theoretical reasons behind this. They think maybe there's some variants that were less responsive, that it was less protective against
Yeah,
in
in
other
some of the
places.
yeah.
But the bottom line is all of the vaccines that are out are close to 100%, almost 100% effective at preventing what we want to prevent, which
Severe
is severe
disease.
disease,
Yeah.
death,
Right.
and
Yeah.
having to be admitted to hospital.
Yeah, right.
So
And isn't on the Johnson and Johnson particularly, doesn't the effectiveness gets better further on past the initial vaccine, right? So a month later,
right, yeah,
it's
yeah.
more
The further out, yeah,
further out
several
you
weeks
go.
out from getting that one, it's a one-time dose, which that's the advantage to that one is it's a one-time dose.
Yeah, one shot. Yeah.
But if you compare apples to apples and looked at Pfizer and Moderna, they're almost identical in the results on those. If you compared the time frame where you get the first shot and then you wait a few weeks, get the second shot, then wait 2 weeks, and then that's kind of the point where they say you're fully immunized. If you wait 2 months after you get the Johnson Johnson vaccine, you might have similar results. But
Right. Okay, yeah, I see. So the time frame that they're looking at is a little different, I
it's a little
guess.
different.
So yeah, okay. All right. Okay. Um okay. It's one question. I'm more concerned about getting the vaccine than getting COVID. Should I be? Why or why not? Assume this is a young, healthy person.
So you personally, maybe, maybe not. Um, even a young and otherwise healthy person, the mortality rate for young people is probably around 0.1%.
0.1?
Yeah, about
One in
0.1.
1,000?
Right.
1 in 1,000.
The chance of you having a severe reaction to the vaccine is anywhere from 1 in 500,000 as high as 1 in 200,000.
Mm-hmm.
So you're at a minimum 200 times more likely to have a bad result from
From
getting the
getting the
virus
virus.
than
Yeah.
you are from getting the vaccine,
Okay.
from what we know, the best available
Right.
data that we have
Right.
right now.
Mm-hmm.
So even just for you personally as a young and otherwise healthy person, for your own personal benefit, the math works out to where it's right.
It's better to take
To
the
do it.
vaccine.
It's less risky to take it
For
than
you.
it even for you, just for you. But then you consider the bigger question, the big picture. What about mom and dad? What about grandma and grandpa?
Mm-hmm.
What about cousin that's immunocompromised and can't get the vaccine, or whatever,
Right. Yeah.
whatever your situation is. There's no doubt that there are people around you, even if you're not high risk yourself. There's probably people around you that are high risk, and you would at least be providing some level of protection for them.
For them. Yeah.
And so that's, to me, the best argument for it is that.
Yeah.
Now, the mortality rate for the high risk, the overall mortality rate is probably somewhere around 0.3%, something like that. Maybe as high as 0.5, but probably, I would say probably around 0.3, based on what I've seen. But young and healthy person, 0.1%. It's similar to the flu.
Right.
Maybe a little bit worse than the flu. But
okay. Yeah.
definitely worth it based on
yeah.
the risk of having a bad
in other
side
words,
effect from
you get the virus, you have a 1 in 1,000, and even if it's as high as 1 in 10,000,
right.
Even if that's the case,
or 1 in 100,000.
Yeah. Right.
Even if it was 0.001%.
So you're trading, what you're doing if you take the vaccine is you're trading the 1 in 10,000 or 1 in 1,000 chance of dying for a 1 in 200,000 chance of having a bad reaction to a vaccine,
and
that you'll survive.
Far,
yeah.
We know of.
Right. So the risk reward trade off for the individual is pretty clear from the data that we have. Okay, roughly what percentage of people will need to be vaccinated to achieve we kind of already talked about this, the threshold, 50 to 90%, somewhere in there. somewhere in
that. I mean, the more the better.
We'll
the
know.
More we get it, the
we'll
better.
Probably know in a year.
Yeah.
We know. Well, we don't know yet. I guess we don't know yet. It looks like though that the vaccine's being effective. I mean, we're down 90% in Arkansas.
Yeah.
It looks like it's working.
Well, the majority of the high risk population that is going to get the vaccine has gotten it.
Yeah.
And so we've seen a drastic drop off in the last couple of months from
Right.
mortality, which is primarily in the older and higher risk population. And so,
yeah, I was going to show I've got the Arkansas numbers pulled up here. So here's where we are, because another question we had was what percentage of the population has been vaccinated, and you can see that in Arkansas, particularly the Southwest quadrant, which is where we are, is 11.2% that has been partially immunized, and then 13.8% that is fully immunized. So we've got 25% of the population down in the Southwest quadrant that is either had the first shot or had the first and the second shot and is fully immunized. So we're the lowest in the state in terms of percentages. And so we really do need more people probably to take the vaccine in order for the vaccine to be as effective as it can be. I mean, you've got higher rates in all the other quadrants of the state.
Yeah.
So you've got 411,000 fully vaccinated, 348,000 that are partially vaccinated. We've had something like 330,000 cases, and so you add all that together, and we're probably approaching about a 40%, somewhere in there, close to that, maybe. 40 to 50% immunity, or 40, 40 between 40 and 50%, somewhere in there, immunity level for the state. So, and we're down 90% in the last month. But we don't know yet. It's too early to call it ball game, but
looking
real good. So if we can keep the momentum going, I think we'll be in good shape. Anything else on that? Information for having the vaccine while pregnant. We've kind of already covered that, but there's really, we don't have enough long-term data to.
There are studies in rats that have shown no adverse outcomes on the mama rats or the baby rats.
Yeah.
For similar, I mean, not this exact, these vaccines, but similar type of vaccine.
Okay.
Or treatment.
Okay. So we're out in the long term yet.
We don't know.
So, but there's no reason to think there would be.
No reason to think that it would be, but there's no way to say with 100% certainty.
Right.
I mean, extremely, extremely unlikely that it would cause any bad effects. There's no mechanism by which it could really. There's not really nothing that would make sense. No mechanism that would make sense for it to cause any birth defects or problems with the pregnancy.
Okay. But if I'm low risk and belong in the group with a 99.9% survival rate, why do I need the vaccine? So, I mean, we've kind of already answered that. It's the herd immunity is the argument. It's not just for you; it's for the other people.
The main thing is to protect people that are not in that very low risk group.
Yeah, right. So, because again, the more of the community that gets the vaccine, the more protection you give to everybody.
Yeah.
To everybody benefits. That's right. So, like if you may think, well, if enough people get it, then it's not a big deal if I don't get it. I mean, that's true, but we need as many people to have immunity to the disease as possible. Yeah. And the higher that number is,
if everybody
the more
thought that way, then we would never get to herd immunity.
Well, we would get there, but it would just be really bad.
Wouldn't be through vaccination.
It would be bad. Yeah.
Right.
So everybody would have to get the virus. Right. Or pretty much not everybody, but most people would have to get the virus.
Do you care about other people enough to take a very tiny risk to potentially prevent somebody that could die from it from getting the infection? And even if somebody has been vaccinated, like we talked about in the study of reinfections, it's a lot less likely to prevent somebody that's elderly or high risk from getting a reinfection. And so even if they get vaccinated, it may not be 100%. It isn't 100%
right
protective. I mean, so far it's the vaccines look like they're close to 100% effective at preventing severe disease, but that's short term. We still don't know exactly. We know it lasts several months at least, but we haven't had a long enough time frame to know for sure exactly how long it's protective.
Okay. Yeah, and again, within the group of vulnerable people, there are people that can't get the vaccine.
Right.
So
Yeah, there's
I mean,
people that their doctor,
you
you
could
know, maybe
yeah.
their cancer doctor says you probably shouldn't get it because of whatever specific treatment you're
Mhm.
getting, or
Mhm.
immune system is compromised, so you shouldn't
Right.
get it.
Yeah.
It's not worth the risk of side effects,
Yeah.
with everything else that's going on.
Right.
But
Right. You're already
it's pretty rare,
compromised.
but
Yeah. Yeah. You're so compromised that this could
it may not
cause you
work
to.
anyway.
Yeah. It may not. You may not have an
Right.
immune response,
Yeah.
or. Yeah.
It's my goal, like Jonathan said. I mean, I want what's best for everybody at the bank specifically, but everybody in general. I'm telling you guys, and the things that I'm saying here is the same thing that I tell my family. It's the same thing that I tell my friends. It's the same thing that, I mean, I took the vaccine myself. I had no reservation whatsoever about taking the vaccine myself. I mean,
Yeah.
I wouldn't tell people to be taking. I wouldn't be encouraging people to take it if I wouldn't do it myself. And it is not something that's a controversy in the medical community at large. The vast, vast, vast majority of physicians agree that it's good for almost everyone,
Mhm.
with rare exceptions to take the vaccine. The benefits way outweigh the risk.
Mhm. Mhm.
And overall, I mean, you can find somebody here and there that might have reservations. There may be some physicians or nurses that don't take it, but the vast majority of the medical community, people that know things about this specifically, and just in the medical community at large, there's the vast majority of people are in agreement. This is a good thing, and this is the
Mhm.
way to move forward,
Right. Right.
and the
Yeah.
safest and best way to move forward. And
Mhm.
so that my goal is to get everybody on the same page with that. Like Jonathan said, I mean, I don't want to force anybody or, twist somebody's arm or make them feel bad. I mean, but really the truth is that this is something that may not be you doing this for yourself. You may have to just make that decision to do something to help other people.
Yeah. Right.
And it, not trying to say you're selfish if you don't do it, but
Mhm.
sometimes, with something like this, you got to think about other people that have the risk that you don't
Mhm.
have.
Right.
And
Right.
so
But thank you guys for listening. Thanks for coming and talking about it.